from Hollywood? I didn't know that. Okay. There's a Hollywood in Florida? Wow. Okay, hi. Hello. Okay, one. I see some ones. You guys ready for Thanksgiving? Hopefully you're ready for Thanksgiving. Okay, awesome. Okay, let me put it like this. Ooh, that's better. Okay, now we're ready. Okay, so if you got the slides, all right, if you got the slides, hopefully you got the slides that I gave away today or last night, if you're on the broadcast last night. And they are slides where I go over what I'm going to talk about tonight, actually, which is preeclampsia. If you did not get the slides, then you can get it one of two ways. It's here on Facebook. So if you're watching this on YouTube, you can't get it from YouTube. You need to go to Facebook. Yeah, that's the only way, honestly. Actually, you have to go to Facebook, at least right now. So go to Facebook, and then it's the first post on our Facebook page, or you can find it in our Facebook group, which is NCLEX Prep for Success. And I posted it, the link to download it today. So it's like different slides that goes over pregnancy. And of course, it's not every single thing about maternal health, but it will get you started with some information and put you in the right direction of what you should focus on. All right, good. Okay, Miami, Florida, Maryland. Okay, so good. So we do got some people who are interested in learning about this. And then same thing on YouTube. If you watch this on YouTube, please comment below and let me know where you're tuning in from, where you're watching the broadcast. And then if this is something you want to know, put one in the chat box. Okay, so let's go right into it. So here's one of the things that you have to understand, and thank you for sharing the video. Thank you for hearting and liking the video. I definitely do appreciate your support. So one of the things that you must understand is, okay, I'm going to talk about two different things that will help you to retain the information. If you struggle with retention, put 2 in the chat box, okay? Okay, if you struggle with, like, you study it, but then you forget immediately, then put 2 in the chat box, all right, if you struggle with retention. So I'm going to give you West Palm Beach, hey, I'm going to give you a tip that will help you to understand, help you to retain, and that will also help you to better understand maternity health, period. So here's one of the things about maternity health. Here's the one thing first about retention. When it comes to retaining this information, you have to be aware that oftentimes there's different stages and different levels of the same thing. Okay? All right. Okay, good. I see lots of 2s. All right. So there's different stages and there's different levels. So meaning that one of the challenges that people have when they take their exam is that they're not aware that on the test, there's actually there's different stages or different levels of the same thing. So you have to be aware whenever you're studying anything, try and pay attention to, or try and look to see if there's different levels or different stages of that same thing. And that's what I'm going to talk about today with preeclampsia, because some people think it's just preeclampsia only, but there's actually different types of preeclampsia, and they're all based on the very specific stages of preeclampsia. So that's the first thing about studying in general, is being aware of different levels, different types, different stages of the same thing. Attention is the answer, pregnancy, right? The only way to treat preeclampsia, that's saying, is to give birth to the baby. So this one of the things is that when you're looking at maternal health information, it matters significantly if it's the first trimester, the second trimester, or the third trimester. All right. So the timing makes a huge difference with the answer. And this is all part of like this development stages. When the child comes out of the womb, obviously this development stages. When the child comes out of the womb, obviously then at that point, that's the part we have to be aware of, like Erickson's stages of development. That happened to you. That's when now you have to be aware of, okay, what happens when they're a newborn? What happens when they're a toddler? What happens when they're like, what is normal and what's not normal? And that's the biggest thing, is that you're going to be presented with scenarios. And in the scenarios, they will say, okay, the baby is this old. Like anytime it says the age and they're under 18, that has to do with some type of developmental stage, and if they're at that stage or not. All right, that was like a tip, a hint right there. So now talking about preeclampsia. So there's 3 different types you want to be aware of. So what is preeclampsia first and foremost? Preeclampsia is when during pregnancy, the mother begins to experience really abnormal blood pressure because of the pregnancy. And that can make the pregnancy, high risk. So pretty much because she's pregnant, the pregnancy it's difficult for her body to tolerate it. And now her blood pressure is increasing. And there's different things that we can, recommend. The first one, of course, is going to be bed rest, right? And so, because whenever we're giving the patient, whenever something happens, we always want to start from the least invasive to the most invasive, right? It's always least to most. And you like, let me just leave it like that. So it's always going to be the least invasive route to the most invasive route to determine what the appropriate intervention is, or what should be done next or first. But obviously, if it's describing a patient that's already in distress, and if you don't do something right now, then that's different. Then we have to obviously respond much more critically. Hello. So least invasive to most invasive. Always remember that. So let's go through each of them. The first one, we have mild preeclampsia. All right. So mild preeclampsia, let me put this in the chat box. Okay. Mild preeclampsia. All right. So mild preeclampsia, and there's very specific markers. So the blood pressure is going to be greater than 140/90. All right. The blood pressure is above 140/90. Okay, that's one of the first factors. The blood pressure is above 140/90, and then they have something called proteinuria. Okay, hello, proteinuria. So proteinuria is pretty much there's too much protein in the urine. All right, so but at this stage, we're only looking at 1+ to 2+. Okay, 1+ to 2+ of proteinuria. So this is where, what will we do? We can, like, we won't do the test, but the patient will have to go through some type of urine test, and we can, get like a urine dipstick, and we're gonna put that stick in and see how much protein is produced in their urine. And why is it that's protein in the urine? Well, because if we think about this, you have to think about the kidneys, and you think about the overall function of the kidneys, and then how it also coincides with high blood pressure as well. So if this condition worsens, the patient over time can suffer from kidney problems. So we're going to see proteinuria, and then we're going to see weight gain. Okay, weight gain of 2 pounds per week. All right, weight gain of 2 pounds per week. Now, of course, there's a normal amount of weight for them to gain, but the issue here is how much and how frequent. All right, so, and then also all the symptoms, right? So in order for it to be classified as preeclampsia, it has to have all the symptoms. So the weight gain, the blood pressure over 140/90, and also the protein 1+ to 2+ urea. So this is significant because what people do wrong when they're taking the test is that they remember only one of the factors and they pick the answer anyways. So for example, let's say the question said that you have a patient and they're admitted to they're pregnant, they're 8 weeks, and they come in for their checkup, and upon assessment, you notice that they were 142 last week, and they're 144 now this week. How should the nurse intervene or respond? You could easily assume, oh, bam, yes, that's preeclampsia because of the weight gain. But you need all the factors. So in that situation, instead of making a diagnosis, we need to get more assessment data. And the best answer would be, okay, do the vitals, right? Do the vitals and probably do them at least 6 hours apart. So that way we can see if the blood pressure truly is elevated. Because, a lot of times too, when patients come to the hospital or see the doctor, it may make them have more anxiety, which could make them have high blood pressure, which we call white coat syndrome. All right. So this is one of the biggest things is that we're gonna see the blood pressure is gonna be up, and then also they're gonna experience 1+ or 2+ proteinuria, and then they're gonna also have a weight gain that's greater than 2 pounds per week. You thought was diagnosed around 20 weeks or more. What did I say? Did I say first trimester or second trimester? I don't remember what I said now. Or third trimester. I don't remember what semester, which one I said, but the biggest thing I want to clarify then is identifying the factors that classifies it as mild preeclampsia. So I'm pretty sure you're probably correct for saying that. But what the biggest thing I want to stress is identifying the difference between the two. Did I say 8 weeks? Really? Okay, I don't remember what I said now. Okay, I'll go back and watch the video to remember what I said. Okay, so then I apologize. Okay, it's going to be further along than that, but I don't remember if I think I was talking about 8 weeks for something else though. Be mindful of all the three factors. I think what I was saying with the 8 weeks, I think I was talking about I think I was talking about something else because I don't think I said 8 weeks for that though specifically. I think I was referring to something else. I lost my train of thought though. Oh, okay. You said starting early on pregnancy. Oh, okay, yes. Okay, yes. Okay, thank you. Okay, you helped me just now. So absolutely, it can be diagnosed around 20 weeks or more, but they can show signs and symptoms earlier. So thank you for saying that. All right. So yes, absolutely. It's going to be diagnosed further along, but some patients may begin to experience symptoms earlier. Not necessarily where the point where it's preeclampsia, but they may begin to experience like higher blood pressure than normal, and then also what's the word I'm looking for, like swelling in their arms and their legs. But it may not be actually called preeclampsia until further along into the pregnancy. So yeah, thank you. Oh, that helped me so much. I was like, wait, what did I say? Okay, yeah, so that's mild preeclampsia, all right? Is now it has all three factors. So that's the biggest thing is that it has to have everything. And this is the thing about this is the thing also when it comes about nursing as well, is really pay close attention to weight gain. All right. So pay attention to the weight gain, because weight gain does matter significantly. This is the reason why. What do? Well, depending on the diagnosis, we may do daily weights, not for this specific type of situation, but just in general, we care about the weight of the patient because that tells us a lot about the progression of their diagnosis. All right, so we have mild preeclampsia. BP is 140/90, 1+ or 2+ proteinuria, and then the weight gain is more than 2 pounds per week. The next one we have severe preeclampsia. All right, so let me put this in the chat box as well. All right, severe preeclampsia. And let me see if people are tuning in on over here on YouTube. So let me not neglect my YouTube audience. Oh, hey, okay, I can see people on YouTube. Hey, okay. So the next one we have is severe preeclampsia. So severe preeclampsia, now the blood pressure is higher. So the blood pressure is going to be, let me put on here, 160 over. All right, so the blood pressure now is 160 over 110. Okay, so we have, but remember though, whenever we're confirming blood pressure, we have to do it at least 6 hours apart. So what we're going to do, for example, okay, the patient will come will see the doctor for their checkup, and let's say the blood pressure is 162/90. Before we can say yes, they have this diagnosis, we're likely going to say, okay, come back tomorrow Unless it's critical, then we'll tell them to go to the ER. But come back tomorrow, and then we're going to check your blood pressure again tomorrow, and that will help us to determine whether or not it is, for sure, severe preeclampsia. So the BP is greater than 160/110, at least two occasions apart. Sorry, on at least two occasions and 6 hours apart. And then they have marked proteinuria. All right, marked proteinuria, which means that it's higher concentration. So we're looking now at 3+ to 4+. All right, 3+ to 4+ proteinuria. Oh, thank you. You're helping me. Yes, thank you for putting the blood pressure on that. I appreciate you. You know what I'm going to do? I'm going to come up with like some type of reward system for my best scriber. Yeah, whoever's like the most like helpful on here, I'm going to think of some way to reward you. Okay, so marked proteinuria 3+ or 4+, and then severe palpable edema. All right, severe palpable edema. So like I said earlier, they can begin, if they're showing signs where let's say they're swelling, like their arms and their legs, right? Because their blood pressure is high. And then, but now with severe, it's actually, sorry, with severe preeclampsia, it's more severe and it's palpable. And there is, what's the word I'm looking for? Pitting versus non-pitting edema, right? So palpable means that I can literally put pressure, right? And I can feel the edema. And and I can feel like I can put pressure, I can feel the edema on their, like literally as I'm pressing down their skin. What is happening? What do you call that? What's another word for that? I want to see if somebody knows. What's another word on the cellular level? This is where your biology kicks in. What's another word for that where I can put pressure and I'm touching the edema? What's going on cellularly? Let me see if you can tell me. I'll give you a hint. It's 2 words. All right. I'll give you a hint. It's 2 words. What do you think it is? What do you think it is? Let me see if somebody posts the answer. All right. What is it where I put pressure, right? It's not pitting or non-pitting edema. I'm not talking about that. But what is happening? No, not petechiae. It's happening on the cellular level. All right. Here's the word. I'll put it on here. We're looking at third spacing here. All right, third spacing. So pretty much we got fluid. Instead of the fluid going into the cells, the fluid are outside of the cells, right? And so as a result, that's why we're seeing edema. That's why the fluid is not, coming out of the skin or something, right? But the fluid it's not going in the cells. Instead, it's outside the cells, and we're pushing down. There you go, interstitial. Yeah, absolutely right. So that's what I'm referring to. Okay. So with severe preeclampsia, we're seeing here they're having, like I said, the blood pressure is above 160/110, at least on 2 occasions, 6 hours apart. They have 3+ to 4+ proteinuria. They have severe palpable edema, so they're like we're pushing on their skin. Not infiltration. So infiltration is referring to more so like IV access. So infiltration would be, for example, if they had an IV or some type of access point, and the IV infiltrated, right? And so now as a result, you can see fluid outside of their you can see like, too much fluid, which is an infiltration of the IV axis. So that's different. Another thing that you see here is oliguria, right? Does anybody know what oliguria is? I'm still talking about severe preeclampsia, all right? Oliguria, who knows what that is? Let me see. And there's a specific number that I want you to tell me. Oh, and then if you find this helpful, make sure you share this video, tag somebody. Thank you already for tagging. Tell me the specific amount. Tell me the specific amount, not just low urine, but you need to know the specifics. So the specific number I'm looking for. And then, yeah, like I said, if you found this helpful, like this video, let me know you're enjoying the information, or heart up the video, share the video, tag And then if you want more information, if you want to get the slides from today's teaching, go on the Facebook page, or and then make sure you join our email list, which is bit.ly/nclex emails. There you go, less than 30 mLs per hour. All right. Oliguria is less than 30 mLs per hour, and then anuria is no urine at all. All right, so there you go. So you always want to be aware of the amount. That matters significantly. Okay, so oliguria, and then also increased serum creatinine levels. All right, so the creatinine levels is abnormal, or higher, greater than 1.2. All right, so that's significant too, because what is this telling us? Their kidney function is worsening, right? Their kidney function is worsening. And then on top of that, we may also see thrombocytopenia as well. Thrombocytopenia with patients with severe preeclampsia. So what's thrombocytopenia? Thrombocytopenia is where the platelet count is low, right? Low platelet count. Here's the thing, though. This is what's interesting. This goes to pathophysiology. Why is the platelet count low with severe preeclampsia? Why is the platelet count low? Think about it. Let's do some critical thinking here. Well, it may be, right? It could be that it's low because the body's just not producing enough platelet cells. That could be one possibility. Or it could be low because the blood volume is diluted. So because the blood volume is diluted, because there's more pressure, like because everything is increased, right? The blood pressure is higher, which is they're probably retaining more fluid, right? So they're retaining more fluid. That's why they're having that palpable edema, right? That we're pushing down on. So as a result, there's more blood volume or water than there is to the cells in the fluid or the cells in the blood. So that could be making it appear like they're thrombocytopenic, but they're not really thrombocytopenic. It just seems that way because it's more diluted, right? It's almost like me having a bottle of water, right? Imagine a bottle of water. I have one in front of me to show you what it looks like. Oh no, I don't have one in front of me. But imagine having a bottle of water, and if I had an empty bottle, let me start like that. If I had a half empty bottle or a half full bottle, right, for optimistic people, and I put a bunch of sand in there. I put some sand in there. If I put more water, right, if I put more water than sand in the bottle, then it's gonna appear to be that there's less sand, but it only seems that way because there's more water. It's like the ocean, right? There's plenty of sand and debris in the ocean, but because there's more water than ocean, it seems diluted. So it's possible that they have thrombocytopenia, but it's not really true thrombocytopenia. It's really because the blood volume is greater to the concentration of platelet counts. All right, so severe preeclampsia, like I said, blood pressure is high. Does that make sense? Does that make sense what I just said right now? Blood pressure is high, proteinuria is elevated, severe palpable edema, all this stuff goes together. All of this stuff has to do with the kidney function. Oliguria, right? They're not peeing enough. Increased serum creatinine levels, so it's more than 1.2. So that means the kidneys is not working as well. And then thrombocytopenia. The last one is eclampsia. Okay, so the last one is eclampsia. So what about eclampsia? So eclampsia, this is the one. It should never get to this point. Okay, it should never get to this point. But eclampsia is like close. There's a very high mortality risk if it's eclampsia. So at this point now, they're having all those symptoms plus seizures, right? So the mother can be experiencing seizures. She could be in a coma. There could be bleeding. The baby, it has a very poor prognosis, right? So eclampsia, we don't want this to happen. And the only way, if it gets to this point, the only way to treat it is to do what? For them to give birth to the baby. All right, give birth, right? Usually a C-section, right? Do some type of C-section. That's the best way to treat this problem, right? Is to just give birth to the baby immediately, as soon as possible. Even if the baby is not full term, it's safer and it's better. But like I said, it shouldn't get to this point. Because if they're having seizures and they're pregnant and all these things are going on, there's going to be there's going to be a bad outcome for the mother, if not potential brain damage, right? A lot of things can go wrong. Okay, so with eclampsia, like I said, seizures, coma, they may experience bleeding in the brain. And what happens if this happens? What do you think I'm thinking about right now? Increased ICP. All right, increased. Is it typing? Here we go. Increased ICP. All right, increased cranial pressure in the brain. Okay, so increased ICP, like I mentioned, cerebral hemorrhage, poor fetal prognosis, and then maternal mortality rate. What I would say, who do you think is most at risk for developing these symptoms? Well, one, mothers who had a high-risk pregnancy before, mothers who have a history of hypertension, right? They have a history of high blood pressure, of course, high-risk pregnancies. And then another one, I've noticed this is more common with African American females than other ethnicities. All right, so these are the things too. Being aware as far as okay, who would be at risk for developing these problems? All right, yeah, obesity, very good, awesome, right? Obesity is also going to be another high risk as well. And then this is the one there was one more. I knew I was missing one. So the very first one, because I mentioned mild preeclampsia, then preeclampsia, severe preeclampsia, and then eclampsia. The first one is preeclampsia. So you have preeclampsia, then mild preeclampsia, then severe preeclampsia, then eclampsia. So there's actually 4 types. I knew there was one more. So preeclampsia, which is the first one, that's when she has high blood pressure and swelling in her feet and legs, and then just 1 plus urine. 1 plus protein in the urine. So the earliest stage. All right, so preeclampsia, did I put this on here? Preeclampsia, okay, the blood pressure is high, so it's not up until it could be near that 140 over 90 range. She's having swelling in her feet, all right, and then she's also having the 1 plus urine. So the biggest difference between preeclampsia and mild preeclampsia is the blood pressure and then the amount of protein in the urine. All right, so preeclampsia, there's just a presence of protein in the urine. Mild preeclampsia is 1 plus to 2 plus. All right, so once again, it's this order: preeclampsia, mild preeclampsia, severe preeclampsia, and then eclampsia. Okay, so make sure you're aware of them. And then as far as, like I said, the treatment, if it gets to really bad, is to give birth to the baby. If not, the way that we can control it is bed rest. Bed rest, or encouraging them to take or prescribing them antihypertensive medications. But here's one thing that you want to remember: they should not take NSAIDs. All right, so when they're pregnant and they have this problem, preeclampsia, no NSAIDs, because NSAIDs have a high risk of bleeding, right, if you take too much of it. So if she's taking this all the time and she's also, pregnant, there's going to be an increased risk of bleeding when she gives birth, or when it's time for her to give birth to the baby. So we want them to take antihypertensive meds, but to avoid NSAIDs, put them on bed rest, encourage them to reduce activity, anything that will help to reduce their blood pressure. But if not, if it just progressively worsens, then they need to give birth to the baby as soon as we can, right? As soon as we can, safely. And usually it's going to be through a C-section, all right? Through a C-section. Okay, so that was it for today, actually. If you did not get a chance already, make sure that you download the slides. What I will do, and what I'll also do too, not right now, but when I end the video, if you put the word me in the comments, you'll get, if you didn't get it already, you'll get the slides. All right, I'll just do it to make it easier for people. If you didn't get the slides, not now, but when the video is over, just type the word me, and then I'll make sure you get the slides. Or just go to the Facebook page and you can get it that way, or the Facebook group. And then last but not least too, this week until Friday, we are having our own Black Friday promotion. So with our Black Friday promotion, you can get 20% off either our RN program, which is called Solid Steps to NCLEX Success for RN. And then and that's our full program. So if you really want like questions and quizzes, and then also content review, farm, maternity health, it comes with courses, bonus courses as well, then check out the RN program. And then if you're taking your LPN exam, then go to LPN Home Study Program.choosingnursing.net, and you'll see on the page everything is discounted. And I believe the lowest one is $17 for the LPN program, and then $37 for the RN program. All right, so if you want to take advantage of that, go to the link to learn more information. And I will make sure you get the slides. Thank you for being here. If you don't get a message right away, just type me again, and I'll make sure you get the slides. All right, that's it. Happy Thanksgiving. Happy Thanksgiving. I hope that you have a wonderful day and a wonderful time with your family, and I'll see you the next time.